Hello, everyone. Today is Columbus Day, and it's a holiday that officially celebrates the anniversary of the arrival of Christopher Columbus into the Americas and everything that happened on October the 12th, 1492. So we celebrate Columbus Day today, and I hope everyone's having a good day. It's a beautiful fall day in West Virginia. The colors are just starting to happen in a lot of different places, and our state's showing off again, and that's what we wanted to do. Unfortunately, since the last time we were here on, I guess it was Thursday, it was Thursday, we have had another 110 deaths. Now, not all of them are since Friday. We have some reconciliation deaths that I'll read to you, and they're a total of 28. 28 out of this 110 are not deaths since we've had since last Thursday, but nevertheless, it is an incredible, vast number of deaths. I stand rock solid in my beliefs that we should all stand behind our freedoms in this great country. But at the same time, all of us should pause and at least offer up prayers and everything for all these folks that we continue to lose. We've got to find some way to stop this, and right now the only bullet in the gun is our vaccinations. So we'll continue to urge you. We will not infringe upon your freedoms, your beliefs, especially your religious beliefs in any way. But at the same time, you've got to realize that we've got to some way stop this, because reading 110 great West Virginians that we've lost is just terrible, and it's really sad. All I know to do is read. We're trying in every way we possibly can to get more and more vaccinated. I think you'll see that the surge, this summer surge, is starting to somewhat ease off, but we knew that we were still going to lose lots and lots of people. It's really a shame, really, really a shame. The 3,867th death, an 81-year-old male from Harrison County. The 3,868th death, a 62-year-old male from Work County. The 3,869th death, a 74-year-old male from Mingo County. The 3,870th death, an 88-year-old female from Tucker County. The 3,871st death, a 71-year-old male from Mingo County. The 3,872nd death, an 82-year-old female from Berkeley County. And the 8,373rd death, a 69-year-old male from Harrison County. The 8,800, let me back up and just make sure I got this right. The 3,873rd death is a 69-year-old male from Harrison County. The 3,874th death, an 89-year-old male from Hancock County. The 3,875th death, a 73-year-old female from Cabell County. The 3,876th death, an 83-year-old female from Marion County. The 3,877th death, a 65-year-old female from McDowell County. The 3,878th death, a 91-year-old male from Webster County. The 3,879th death, a 66-year-old female from Wood County. The 3,880th death, a 61-year-old male from Raleigh County. The 3,881st death, a 70-year-old female from Marshall County. The 3,882nd death, a 43-year-old female from Jackson County. The 3,883rd death, a 61-year-old female from Raleigh County. The 3,884th death, an 89-year-old female from Kanawha County. The 3,885th death, a 59-year-old female from Mingo County. The 3,886th death, a 74-year-old female from Tucker County. The 3,887th death, a 48-year-old female from Cabell County. The 3,888th death, a 77-year-old female from Randolph County. The 3,889th death, a 79-year-old male from Logan County. The 3,890th death, a 61-year-old female from Jackson County. The 3,891st death, a 51-year-old male from Wood County. The 3,892nd death, a 92-year-old female from Boone County. The 3,893rd death, a 65-year-old male from Raleigh County. The 3,894th death, a 47-year-old male from Doddridge County. The 3,895th death, a 70-year-old male from Harrison County. The 3,896th death, an 88-year-old male from Lewis County. The 3,897th death, a 77-year-old female from Webster County. The 3,898th death, an 80-year-old female from Jefferson County. The 3,899th death, an 83-year-old female from Mercer County. The 3,900th death in West Virginia is a 49-year-old male from Kanawha County. The 3,901st death, an 81-year-old male from Jefferson County. The 3,902nd death, a 71-year-old female from Mingo County. The 3,903rd death, a 51-year-old male from Marshall County. The 3,904th death, a 102-year-old female from Jefferson County. The 3,905th death, a 71-year-old male from Lincoln County. The 3,906th death, a 72-year-old female from Kanawha County. The 3,907th death, a 57-year-old male from Boone County. The 3,908th death, a 67-year-old female from Logan County. Here's the 28 reconciliations that we have. The 3,909th death, a 72-year-old male from Pleasants County. The 3,910th death, a 77-year-old male from Pleasants County. The 3,911th death, a 72-year-old male from Cabell County. The 3,912th death, a 93-year-old male from Fayette County. The 3,914th death, a 68-year-old male from Putnam County. The 3,915th death, a 75-year-old male from Monongalia County. The 3,916th death, an 88-year-old female from Greenbrier County. The 3,917th death, a 58-year-old male from Marion County. The 3,918th death, a 79-year-old male from Raleigh County. The 3,919th death, an 80-year-old male from Upshur County. The 3,920th death, a 62-year-old male from Wyoming County. The 3,921st death, a 68-year-old male from Berkeley County. The 3,922nd death, a 94-year-old female from Marion County. The 3,923rd death, a 74-year-old male from Lincoln County. The 3,924th death, a 54-year-old female from Kanawha County. The 3,925th death, a 78-year-old male from Mingo County. The 3,926th death, a 55-year-old male from Wyoming County. The 3,927th death, a 52-year-old male from McDowell County. The 3,928th death, a 62-year-old female from Monongalia County. The 3,929th death, a 71-year-old female from Mercer County. The 3,930th death, a 53-year-old male from Mercer County. The 3,931st death, a 92-year-old male from Ohio County. The 3,932nd death, a 93-year-old female from Kanawha County. The 3,933rd death, an 87-year-old female from Cabell County. The 3,934th death, a 60-year-old male from Marion County. The 3,935th death, a 73-year-old male from Pleasants County. The 3,936th death, a 68-year-old male from Preston County. The 3,937th death is a 56-year-old male from Mason County. The 3,938th death is a 73-year-old female from Wirt County. The 3,939th death is a 62-year-old female from Boone County. The 3,940th death is a 70-year-old male from Raleigh County. The 3,941st death is a 71-year-old female from Harrison County. The 3,942nd death is a 49-year-old male from Kanawha County. The 3,943rd death is a 51-year-old female from Wayne County. The 3,944th death is a 60-year-old female from Preston County. The 3,945th death is a 70-year-old male from Harrison County. The 3,945th death is a 70-year-old male from Hampshire County. The 3,946th death is a 75-year-old female from Jackson County. The 3,947th death is a 56-year-old male from Preston County. The 3,948th death is a 68-year-old male from Taylor County. The 3,949th death is a 74-year-old female from Cabell County. The 3,950th death is a 51-year-old male from Ritchie County. The 3,951st death is an 82-year-old male from Greenbrier County. The 3,952nd death is an 80-year-old male from Fayette County. The 3,953rd death is a 77-year-old female from Preston County. The 3,954th death is a 71-year-old male from Wayne County. The 3,955th death is an 86-year-old male from Harrison County. The 3,956th death is a 79-year-old female from Raleigh County. The 3,957th death is a 79-year-old male from Wayne County. The 3,958th death is a 93-year-old female from Morgan County. The 3,959th death is a 49-year-old female from Cabell County. The 3,960th death is a 57-year-old male from Cabell County. The 3,961st death is a 63-year-old female from Wayne County. The 3,962nd death is an 81-year-old male from Cabell County. The 3,963rd death is a 47-year-old female from Marion County. The 3,964th death is a 90-year-old female from Marshall County. The 3,965th death is an 83-year-old male from Ohio County. The 3,966th death is a 50-year-old male from Boone County. The 3,967th death is a 76-year-old female from Harrison County. The 3,968th death is a 56-year-old female from Marshall County. The 3,969th death is a 56-year-old female from Berkeley County. The 3,970th death is a 58-year-old male from Jackson County. The 3,971st death is a 73-year-old male from Tucker County. The 3,972nd death is a 42-year-old female from Wayne County. The 3,973rd death is a 51-year-old male from Randolph County. The 3,974th death is a 67-year-old female from Monongahela County. The 3,975th death is a 72-year-old male from Wayne County. In West Virginia now, we have 3,976 people that have died from this dreaded disease. It's a 52-year-old female from Logan County. You know, you just read through them, don't you? Person after person after person after person, great West Virginians. Great West Virginians that we love and we've lost. This pandemic's been tough stuff. We urge you to get vaccinated. It's the only way in the world that I know. It's the only thing on earth that I know that can absolutely slow this down. But with all that, we respect, don't we? But more than anything, I ask for your prayers for these great people. So much wisdom, so much good stuff, so much life they had in front of them, and we've lost them. So really, offer up your prayers, and if you happen to know these folks and everything, please call them. Please go see them. Please reach out a hand to where they know they're not alone. Our active cases are down by 10,561. We're down over 1,000 from the last time we were together. We have 757 new positive cases. That's down significantly. Our cumulative rate now is over 6%. We knew that would get there as we've just gone more and more and more up. We were at a peak of hospitalizations of 1,012, and now we're down to 840. We were at a peak on the ICU units of 296, and now we're down to 250. And we were a peak on the people that were on ventilators of 195, and now we're at 168. You know, we've dropped. We've dropped from the peak that we knew where the surge would go. And we hope and pray in every way that it'll turn, and it will absolutely, it will turn only to get better and better and better, and the numbers will drop more and more and more significantly. I worry about the cold weather. We do have 3 green counties in our state now, but I worry a lot about the cold weather coming. And as the cold weather comes, we'll be inside more. I worry that this could turn and we could have some whiplash effect, you know, and let's just hope and pray that we're going to continue down. 61 school outbreaks now in 25 counties, 673 confirmed cases. There's 2 counties out there that don't have mask mandates, and that's Pocahontas and Tucker. I remind everybody again about the antibodies and everything, especially if you're 65 and older and everything, and you get sick or you feel the least bit bad, you better go get a test. Because really and truly, if you get this, it will be really, really tough to survive it. So if you're 65 and older and you have any symptom, go get a test. The antibodies will save your life, and they'll stop this thing. At least we hope and pray they will. From the standpoint of wearing a mask indoors, if you're 65 and older and you have some kind of compromising situation, diabetes, whatever it may be, and you're in a crowd of people and everything, in an indoor setting especially, you really need to consider wearing your mask. You know, we do have an outbreak at a veterans nursing home, and I want to read this to you. There's a small COVID outbreak at the Clarksburg Veterans Nursing Home, and that our State Department of Veterans Assistance operates. We currently have 8 residents in the Alzheimer's unit that have tested positive. None are hospitalized at this time. Additionally, 2 staff members have tested positive, and we're running absolutely to the fire as we do over and over. The National Guard will be at the facility as soon as possible to perform sanitation work, and also we're sending a team, you know, to work with the folks there, you know, on antibodies at the facility, you know, and going through everything we go through all the time. One thing about it is we don't lay down. We absolutely run to the fire, and at this point the facility has only and had a total of 12 cases from the beginning of the pandemic, and so this is an outbreak where our heroes are in every way, and we're going to do any and everything we can to assure that this is snuffed out as quickly as we possibly can. I've told you over and over about our boosters. They're ready to go. If you're 18 years of age and older and you have absolutely gotten yourself fully vaccinated, what are you waiting on? What are you waiting on? We're doing a good job as far as getting the booster shots in arms and everything, but you need to run to the fire and get that booster shot as well right now. I think the only thing is, if you've lost your card, you know, if you'll call the DHHR, we'll get you another one, and we'll get that to you really quickly. Numbers continue to get better and better and better. We've done 4,561 doses since our last meeting. That's good. I mean, you know, it could be better, but we're still getting people. That's 4,561 we didn't have. You know, from the standpoint of those 12 and older that have gotten their first shot, now we're up to 65.7% of those. That's not too terribly bad. We're at 81.2% of the 50-year-olds and 91.3% of the 65 and older, and that's all good. We gave away a Corvette, you know, on our round 2 baby dog, Do It for Baby Dog here in Charleston on Friday night, and that's Kathy, baby dog, myself, and a wonderful, wonderful National Guardsman, Michael Beal. Michael, we kind of tricked him a little bit and got him down here and everything. He's from Hedgesville, and really and truly, what an incredible, incredible man and everything. He is a firefighter in our 167th airlift wing in Martinsburg and at the Martinsburg, Virginia Medical, or Martinsburg VA medical facility. And so, Michael, we congratulate you, and it couldn't, I mean, how could it be any better? I mean, really and truly, how in the world could it be any better? I mean, we're down here at an incredible car show, you know, maybe the best on the whole East Coast, but surely the best in West Virginia. And we were able to give this wonderful, wonderful prize to a gentleman that had gotten himself vaccinated, registered and everything, and lo and behold, he's a big winner. And I think Michael was driving he shared this information with us and everything. I hope he won't, you know, care about me sharing it with the others, but I think he was driving a 1991 car and everything. So this is a little bit of an upgrade from that. And I love the license plate, but that's a fancy Dan car right there and everything. So anyway, we congratulate him, and more than anything, we thank him for being vaccinated. But more than anything, we thank him for defending us and all the great work that he does in the National Guard. I don't know how it got any better than that, but what a great recipient and everything. Great young man. I'm just going to run through these last announcements and everything. A vaccine eligibility 12 and above. I need the parents and the grandparents to help us get these kids vaccinated. I am telling you without any question, the weather's going to get bad. As the weather gets bad, our kids in schools need to be vaccinated more than anything. We need to get those kids vaccinated. It's so safe, it's unbelievable. Now let me just tell you again. You know, if my children and your choices, whatever your choices are, the parents should be deciding. But whatever your choices are, we're going to honor, aren't we? I've said it over and over. We're going to stand by our freedoms first and foremost. I have said it over and over. But absolutely, you know, I would tell you as a parent, as a loving parent, on a vaccination that we know is incredibly safe, beyond belief safe, you know, and with all of that, we know the side effects from the vaccination are almost nothing. But yet, we know the side effects from a child getting this disease, and they can get it so easy it's unbelievable, could very well be big. And so with all that being said, I would absolutely ask you again, rethink this whole process. Those kids need to be vaccinated. They're going to be together, and kids are going to be kids. And the chances of the level of infectious that this variant is, the chances are very high that they could even get this and not even know they've gotten it. You know, and at the end of the day, absolutely, the side effects could come throughout their life. I'm not trying to scare you in any way. No way. I'm just trying to tell you the truth that has been passed on to me by the medical community, and I am with them all the time. They need to be vaccinated. I ask our grand families, 19,000 kids live with you. 19,000 kids. You need to help us get them vaccinated. You need to take advantage of that $150 voucher. All the information's up on the COVID, 19 line and everything. All the stuff about the free testing is all there. Again, I want to always thank Frith and Walgreens. You know, they stepped up early on, did they not? And so nevertheless, let's just absolutely do any and everything we possibly can and everything to always thank and appreciate others. The community, we have a community health center. Thank you. Today I want to thank and a shout out to the West Virginia Primary Care Association and its 32 communities. And you can probably hear these people, you know, that are outside voicing their opinion. There's a few people here. There's probably, I don't know, 15 people here. And they are absolutely adamant about just this, about they want their choice and the parents' choice, absolutely without any question, they want that, in regard to whether or not they should be vaccinated or not. I personally believe, and I wish like crazy, that they would consider being vaccinated. But at the same time, I absolutely honor and respect, their opinion, and I stand steadfast with absolutely those freedoms. I have said it over and over. Now the legislature is back in session, and we're going to have some level of outburst or whatever it may be, and as we go through the next few days with the legislature being here. But I want to honor those people, and I want to respect those folks and everything. I've stood up and I've stood steadfast. I have stood steadfast, and my feelings are really simple, and that's just this. We should have our parents deciding. We should absolutely not be mandating, whether it be our employers or whomever it may be. However, our private businesses are our private businesses. We should not be trying to tell a private business what they should do and what they shouldn't do. But with all of that, because if we stand rock solid by our beliefs in mandates, against mandates, we shouldn't be mandating what a private business decision should be. We shouldn't be mandating anything. And from the standpoint of standing behind, President Biden's mandates, I am adamantly against that, So in all of that, what I'm saying is we're almost contradicting our own self. We're saying on one hand, that we absolutely should stand by our freedoms, and we should, should we not? And then on the other hand, we're saying we want to mandate things against our private businesses, and that's really tough, really, really tough. From the standpoint of our community health center, again, I want to thank, and give a real shout out to the West Virginia Primary Care Association and its 32 health center members. Just think about it. They have absolutely served 470,000 West Virginians and helped them with their health care needs. It's an incredible work, incredible. And that equates to more than 1 out of every 4 of our citizens that they have really helped. It's an incredible work. Our health centers have been leading the charge, particularly in the most rural areas with the COVID-19 testing and vaccinations, and now they stepped up to provide more antibodies at 40 sites throughout the state. Their efforts, both on an individual basis and with the hospitals and with the local health departments and the pharmacies, over and over, what more could they possibly have done? We need to thank them beyond belief, and we just can't thank them enough. But again, our community health centers, what an incredible job with all the folks that I've mentioned already have done. So I just couldn't possibly be happier. I want to remind you again about this rental assistance program. It is for the renter and it is also for the landlord. Now, I think we have used up about $47 million of a potential $200 million that we have there. And I want you to absolutely, if you've had some undue financial hardship due to COVID, please, if you are a renter or a landlord, take advantage of this. It's just more money that's going to be in our system in this state, and absolutely we need to know that the more dollars we can put out and put to work on a multiplier effect, the better off we'll all be. I again remind you, it's the flu season. I have had my shot, probably now a little over a week ago. I would highly recommend that you get your flu shot, and I would also tell you that you can get your flu shot the same day you get your COVID-19 vaccination. So you can do them both at the same time. If you've had your COVID shot and everything, surely you go do your flu shot, but we're just trying any way and every way we can to stop this dreaded killer from killing our people, and we're trying to protect you from the standpoint of the flu season as well. So nevertheless, that's all I got right now.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. As the governor has told us, getting immunized is still the most important and most effective intervention to reduce the risk of COVID-19 deaths, hospitalizations, or long COVID. An important study that just came out in the Journal of the American Medical Association Pediatrics issue demonstrated that in a study in 2 states, in New York and Utah, that a kindred of about 1,236 people tested demonstrated that children and adults had about the same infectability with COVID-19. So the mystique that children were somehow more protected from COVID-19 than adults is not true, at least in this study. But it did demonstrate that children, about half the time, had disease that was asymptomatic versus in adults over 18 or greater, that only happened about 12% of the time. So really important, as the governor said, to also very much choose to vaccinate your children, as well as get vaccinated yourself. And if you've been fully vaccinated and you're over 6 months done with the Pfizer vaccine, please look at all of the indications and consider getting a booster dose if you're over 18 years old. The FDA will meet this Thursday and Friday to consider the use of Moderna for boosters, Johnson & Johnson for boosters, and also the potential that we may be able to safely mix and match vaccines. So for instance, those folks that got the Johnson & Johnson vaccine may be able to get a Pfizer or Moderna vaccine as the second dose. And in a study from England, looking at a similar vaccine to Johnson & Johnson, the AstraZeneca vaccine, both using the same sort of technology to immunize, that the addition of a messenger RNA vaccine, Pfizer in this case, increased antibody levels more than the second vaccine of AstraZeneca did. So maybe an important opportunity for us. And then in a couple of weeks after that, the FDA will meet to look at the safety and the potential authorization of the use of vaccines in 5 to 11-year-olds. And again, as we talked about, that will likely be a different dose, about a third of the dose of Pfizer that adults get. And for the Moderna booster, probably half the dose that people got in the initial immunization, 50 micrograms versus 100 micrograms. The governor's read a lot of names for us, which should be sobering to all of us as we're approaching 4,000 deaths. And on this Columbus Day, our country has suffered 700,014 deaths from COVID-19. And while we have seen some reduction in the numbers of new cases, we should not lower our focus to make sure that we are protecting ourselves, protecting each other. Another recent study suggested that about a third of people who developed symptomatic COVID-19 were experiencing symptoms that were consistent with long COVID 3 to 6 months after recovering from the acute infection. So this infection is nothing to play around with. We know in West Virginia, we are very proud of our people, as the governor said, running to the fire, pulling the rope in the same direction. It's not over yet, West Virginia, and particularly looking at the number of people dying every day, looking at our hospitals, particularly our ICUs and ventilator number of patients still very high. It's very important for us to take appropriate precautions and get fully vaccinated or get boosted if you're fully vaccinated and eligible. Thank you.
Thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. As the governor did, I'd also like to thank the Primary Care Association, the 32 facility clinics that serve 470,000 people. Particularly thank Sherry Farrell, who is the head of the Primary Care Association, been a key member of our Joint Interagency Task Force. this group is going to be key going forward to us continuing to improve our vaccination rates throughout the next several months. So we thank them for the great work that they do. As Clay pointed out earlier, our hospitalization numbers have somewhat stabilized, but they are still high. 826 West Virginians in the hospital. Particularly concerning is 248 in the ICU and 171 on ventilators. We will continue to press out a significant number of doses this week. 40,000 doses will be going out, and those are not just for first doses, but a lot for booster doses as West Virginians continue to get their booster doses at a number of locations across the state of West Virginia. And I'll leave you with a couple of thoughts. One is this weekend, 6 firefighters, fallen firefighters, were honored. One of those, Logan Young, a young 30-year-old West Virginia Guard firefighter at the Martinsburg 167th unit, who lost his life responding to a fire outside of the base in support of the local community last year. So I would just like to send on from my family and all others here on the team our thoughts and prayers to Logan's family and all the fallen firefighters who were honored over this past weekend, to their families. And just the last thing, again, to reinforce the governor's point, our silver bullet is the vaccine. We will do everything we can to educate more West Virginians to the value of the vaccine so that they can make the right decision. And I think back 570 plus days ago, when we were just scared to death that we would lose 64 West Virginians, when that was the predicted number. And to date, our governor has had to read 3,976 names. We've got to continue to think about getting vaccinations. That is our key to success. And we've got to understand, if we look back at the history of the 1918 pandemic, we have probably at least one more surge and maybe another surge to come in this country. And those can be mitigated by the number of West Virginians we get vaccinated. Thank you.
Thank you, sir. Next, we'll go to Dr. Ainam Jadar, State Health Officer.
Good morning. Just to remind everyone, and the governor did mention it earlier about the importance of flu vaccines. There's another vaccine that I want to remind everyone about getting, and that's your pneumonia vaccine. Most people get that before age 65, but also after age 65. That's very important. So when you're getting your vaccines, when you're getting your flu vaccine, hopefully you're also your booster vaccines for COVID to also get your pneumonia vaccine. Also, October is Breast Cancer Awareness Month. A lot of people have put off getting their routine mammograms, but that is something just to remind everyone out there as well. Thank you.
Thank you, Doctor. Secretary Bill Croucher, the DHHR, is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, thank you for taking my question. First off, I want to mention a friend of mine, Chris Ice, who passed away last week after almost 3 weeks in the ICU with COVID. So he will be missed by his family and friends. And it's just another sad day in the midst of this pandemic. I have a couple of questions for you guys if you can follow along. One, is there any way to get the number of breakthrough cases and deaths from vaccinations since the start of vaccinations? It looks like that the DHHR site is using total number of confirmed deaths and total number of breakthrough deaths, but the confirmed deaths before the vaccine really kind of skew those numbers a little bit. And the percentages would be, at least I think they would, probably higher of breakthrough cases and deaths if we had the numbers just since vaccination started. So if somebody could look into that or answer that, that'd be great. Second question, real fast. We're starting to see flu cases at various and sundry healthcare centers. I got word from one that there were 7 cases on yesterday, which were discovered. What are the dangers of the twin-demic, I think it's being called? And when you talk about those vaccines, are they safe to take at the same time? Thank you very much.
Okay, Kenny, let me make one comment real quick, and then I'm going to defer to Secretary Crouch. You know, I think they're going to, and to Clay also, Dr. Marsh, I think they're going to tell you absolutely they're safe to take at the same time. Well, I'll just hold up because they'll be able to answer this better than I. But Secretary Crouch, if you'd answer the first part, and then Dr. Marsh, please.
Yes, thank you, Governor. Thank you, Kenny. It's a great question. There are data available, and we will get that information to you. We don't have that on the dashboard in terms of the cutoff once the vaccination started. But the breakthrough information, the breakthrough cases that you're looking at on the dashboard are of those individuals vaccinated. So the breakthrough information is accurate because it's based upon the total number of people vaccinated, but the information in terms of total deaths, that's a good point. We'll pull that information together and report that on the next press briefing. Clay, you have anything to add to that?
Bill, if I'm not mistaken, actually, if you go on the website under breakthrough data on the top, it does give the data, at least that's how I'm interpreting it, from the number of cases since the start of the vaccination and the number of deaths since the start of the vaccination. So it looks like cases are 7.59% and deaths are 7.26%. If you go on over to the top of the website after cumulative summary, we have there that data. I think, isn't that correct, Bill, or am I wrong?
I think you are correct, Clay. Thank you.
Okay.
So it shows 2,866 deaths since the start of the vaccination. So you subtract that from the number on the previous dashboard on the first tab, you get the total number for each. So thank you, Clay. That is good clarification. Thank you.
Good. And then, as the governor said, Kenny, getting both vaccines at once is safe and effective and important, just so that we get both shots in the arms.
All right, thank you, Kenny. Next, we'll go to Annie Moore with WVVA.
Hi, I see on the graph that hospitalizations and patients on the vent is going down. Is this relief concentrated in a specific geographical area, or are we seeing relief on the hospitals statewide?
Dr. Amjad, please go.
Yes, I wouldn't, it's hard to say if it's a geographical set that we're seeing, Annie, but statewide, we're seeing a decrease in cases overall over the last couple of days to weeks. So I think most of the major hospitals are still seeing their overall decrease trend, but I wouldn't say it's a geographical trend that we're seeing, because statewide we have seen a decrease in cases. Over the last 3 days, we've had less than 1,000 cases statewide, so that is helping. But I don't see a geographical trend necessarily on the hospitals, north or south particularly. Thanks.
All right, thank you, Annie. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I wanted to ask, are there plans for any further incentive programs going forward? I know this round of the Baby Dog Lottery focused on, teenagers and young adults. Are we going to do any more incentive programs, say when, the youngest eligible kids come online in the next round? Thank you.
Charles, we don't have it put together right yet, but I would think we would sure try. We're really close to doing this, to putting something else together, and it may be do it for Baby Dog round 3, but and if we do that, we'll come out with it real soon. It'll be more tailored than even the last go round toward our kids, especially maybe some of even our younger kids, but nevertheless, Charles, we're going to just keep trying. I mean, we've got, Fed dollars available. We're getting people vaccinated, slow but sure, but we're getting them vaccinated. So I don't know anything else to do. And I'd be welcome to any and everybody that had an idea other than just batting down the hatches and staying at home. and I'm not much for batting down the hatches and staying at home. I'm all about trying to get something done and move forward. And we've got our state cooking from the standpoint of the economics, and we want to just keep going. So yeah, Charles, we're probably going to come out with something else.
All right, thank you, Charles. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. Let me tell you where I'm coming from with this one. Last week about this time, there was an arrest made in Davis, West Virginia of a Maryland man who shot and killed a lady in Cumberland, then drove to Baltimore and shot and killed his brother and wife in Baltimore over his claim that the brother was a pharmacist and was injecting the vaccine into people, and he thought that was the wrong thing to do. Now, that's an extreme case, but some of the vitriol that we're seeing on social media between the vaxxers and the anti-vaxxers certainly is not very healthy. Is there a concern, maybe General Hoyer and Secretary Crouch may be the best to answer this, is there a concern that some of that may bleed over and lead to threats against the people that they have administering vaccines, both at the health department level and also with the National Guard? Thank you.
Paul, let me just answer for them, because ultimately, you know, all this is going to fall back to me. And Paul, all I can say is simply one thing. When we get to the point in time where we're imposing our individual beliefs on others in America, that's the wrong thing to do. Either way, it's the wrong thing to do. Now, we're getting through this, and we're getting through this the very best we can. We sure as hell are not going to get through this if we start dividing our people and lining up vax against unvax. You know, absolutely. Do we not see with all in us that without any question, if we keep pulling the rope together, we'll get there. We'll get there. We shouldn't be looking down our nose at either side. We should be reaching out and trying to help one another. What I'm trying to do every single day is encourage and educate more and more and more the safeness and the goodness about these vaccines, and the simple fact that we don't have any other bullets in the gun. There is no other bullet in the gun. So we can either just stand down and not do anything and wait. And we know, at least we know from all the standpoint of everything that the medical community tells me, we know if we do that, we're going to lose even more. So we try. And it's not easy to try and everything else, but Paul, you know, there's nothing that anyone could possibly condone anybody for committing violent crimes or absolutely, you know, developing an opinion to where they trying to impose that belief on others. We need to absolutely be respectful. You know, we don't need mandates. We absolutely need to just keep pulling the rope together and we'll get there. But Paul, if we don't pull the rope together, and this nation is divided enough. I mean, for crying out loud, the one thing good about West Virginians is we've stayed together, and they've believed in me, and they have my trust, and I have theirs. And so with all that, you know, we're just going to keep on trying in every way to get there, but we will get there. We'll get there. You know, just if we can save a few more along the way, we're going to save more along the way, but we'll get there.
All right, thank you, Paul. Next, we'll go to Evan Bevins with Ogden Newspapers.
Thank you. I was wondering about the latest statistics for the correctional system. I know a few times the overall numbers have been mentioned, but I think the most recent breakdown for facilities was last posted for October 1st.
General, if we could hear from you, sir.
Yes, sir, Evan. I don't have those numbers right away in front of me, but I will get those to you later today, updated numbers.
All right, thank you, Evan. Governor, I'll turn it back to you.
Well, and again, I try to make myself notes, on what people say along the way, but we've lost 3,976 people in West Virginia. It just sounds like a number, doesn't it? It especially sounds like a number until a good friend like Kenny Bass said, Chris, that he lost and everything. And it's a shame. And it really hits home. I would just say this to you, if I had come out, and I can remember like it was yesterday, all these milestones. I can remember my basketball team playing basketball in the state tournament, the girls' state tournament here. We were within a couple of hours of playing, and we were playing. It just so happened that Martinsburg at that time, we'd already played them during the course of the regular season and won the game by 25 or so points. So it felt like, well, we're going to get by Martinsburg, and then we're going to end up in the semifinals, and it may very well be that we were going to end up playing Woodrow, which I love totally to death. And the kids were really excited and everything, and then all of a sudden this thing is just raging, and all of a sudden we pull the plug on our state tournament. And then as we go, the general mentioned, we lost. There was a time when there was an agency out of Washington State, and they said West Virginia is predicted to lose 74 people in this pandemic. 74. And at the time we'd lost, we'd lost, 32 people or something like that, and there was no way. There was no way. Couldn't possibly happen. No way. None of us would have believed it. For crying out loud, we couldn't possibly lose 74 people in this. We couldn't possibly lose an equivalency of multiple mine disasters that we've had in the state that absolutely we just mourned over for weeks, if not years. 74 people. We couldn't lose 74 people. And now we've lost 3,976 people. Along the way, the Delta variant came into being, and we had 3 cases, and then we had 12 cases, and we thought, well, in West Virginia, we're not going to have many cases and everything. And then all of a sudden it runs rampant all over our state. Now, what if, just as something to think about, but what if right after canceling the state tournament, I could some way have had a crystal ball and told you, said, in West Virginia, we may very well lose 5,000 people before this is over. We hope and pray it's going to stop at 3,976, but all of us know we're going to lose more. How many more are we going to lose? Could it be very possible that we could lose 5,000 people in the state of West Virginia? And if I'd have told you that at the time, what would we have done to prevent that? If we really knew, what would we have done to prevent it? We'd have done almost anything, wouldn't we? We've lost a lot of wisdom, and we've lost a lot of people. And all I know we can possibly do is be what I've said 1,000 times. Be respectful. Be loving of each other's opinion. Be absolutely embracing, absolutely, of all West Virginians. Stay together. Stay together. This is tough enough. We don't need to be divided. We don't need to throw rocks at one another. A lot of people on the outside have always thrown rocks at West Virginia. We don't need to throw rocks at one another. So with all that being said, we'll get through this, West Virginia. It's been a rough road. It's been a tough time. You've led the nation. You've shown just how great you really are in so many different ways. Keep doing it. Keep doing it. Some way, somehow, keep doing it. We'll get through this. Absolutely. Just continue to shine brightly. Be proud of your own pond. Be the diamond in the rough that everyone missed. Be the news that just came out the other day that all your surrounding states, you know, your GDP growth is better than all your surrounding states. Keep doing it. Come out of the gates and absolutely get these booster shots like crazy and lead the way again. Just keep doing it. But in every way, be respectful of your neighbors and their opinions, and be respectful of your fellow man. Thank you so much. You know, I truly do believe that God above is watching after West Virginia, and I know in my heart He's watching after me. So absolutely, let's just some way, somehow, just keep going and keep going north. We're going to get through this. Thank you so much.